Today's presentation will be COVID-19 and food insecurity, spatial dynamics of emergency food assistance use in Cleveland, Ohio. For those of you who are joining us for the first time, or if this is a repeat visit, we encourage you to please use your social media to promote your thoughts and questions about today's presentation. You can visit our website at www.prchn.org and find us on our social media handles on the right-hand side. We always like to mention our next seminar at the beginning of our current seminar, so we hope that you will please plan to join us on November 10th for our next seminar. Oops. My mouse is a little sensitive today. I apologize for that. For our next seminar, which will be Understanding Neighborhood Level Vulnerability, Use of Community Sentinels to Study Public Compliance of COVID-19 Mitigation and Behaviors. So we'll continue a little bit of a focus on COVID-19. We have a very wonderful panel of researchers from across our campus, and you can register today at the link that is included. We will go ahead and put that in the chat for any of you who would like to go ahead and get that taken care of today. We are able to, we've changed our format for those of you who joined us last year, but we would still ask you to add your name and organization in the chat to introduce yourself to others that are joining the call today so everyone can kind of get to know who's here. We're going to ask you to keep your sound muted and your video off during the presentation, but we encourage you to turn that back on for our Q&A period. We'll ask you to use the chat box feature actually to type in your questions or raise hand if you would like us to give you space to talk and ask your question out loud. And finally, it is my absolute pleasure and honor to introduce our speaker for today, Dr. Owusua Yamoah. Dr. Yamoah is a postdoctoral scholar at the Marianne Swetland Center for Environmental Health at Case Western Reserve University. And she holds a PhD in spatially integrated social sciences from the University of Toledo. Her research is focused on promoting equitable food systems and food sovereignty in the city of Cleveland through the development of tools and resources designed to promote community engagement and local decision-making and food systems change. She adopts a participatory system modeling approach and geospatial techniques to map out the complexities and dynamics of the local food system. And we're so excited for her to present her work with us today. So with that, Dr. Yamoah, I will go ahead and hand the floor over to you. Thank you so much. Okay, and you're still on mute.
Sorry. Are you able to see my slides okay?
We are, yes.
Okay, awesome. Well, good afternoon, everyone. Thank you so much for the opportunity to present preliminary findings from my study on emergency food assistance and food security in the city of Cleveland. Before we begin, I would like to acknowledge the land on which we reside. In recognizing the land upon which we reside, we express our gratitude and appreciation to those who lived and worked here before us, those whose stewardship and resilient spirit makes our residence possible on this traditional homeland of the Lenape, Delaware, Shawnee, Wyandotte, Miami, Ottawa, Potawatomi, and other Great Lakes tribes, Chippewa, Kickapoo, Way, Piankeshaw, and Kaskaskia. We also acknowledge the thousands of Native Americans who now call Northeast Ohio home. Case Western Reserve University and the greater Cleveland area occupy land officially ceded to 1,100 chiefs and warriors signing the Treaty of Greenville in 1795. We do recognize that in the times following this treaty, there has been many other people who tended this land, and we pay homage to their commitment in caring for this sacred space. I just want to go ahead and share a little bit about myself. As already said by Erica, I am a postdoctoral scholar at the Marianne Swetland Center, which is housed in the Department of Population and Quantitative Health Sciences at Case. I graduated with my PhD in Spatial Integrated Social Science from the University of Toledo. My earlier training has predominantly been in community development and local government management. As a researcher, I do consider myself a geospatial and community development scientist with interest in reducing health disparities through food systems research. My earlier and current research focuses on food systems and health disparities. I've also done some work in COVID-19 and community health, as well as my focus on geospatial analysis for community development and population geography. Today's presentation is part of my work focused on promoting equitable food systems and food sovereignty in the city of Cleveland. Well, in the area of food systems and health equity, I am currently involved in 4 main projects. I am the PI for 2 of them, which is the Emergency Food Assistance and Food Security Study and the Farmers to Family Study. In the Farmers to Family Study, I am collaborating with about 10 other researchers all over the country to explore the collaborative efforts between contractors, farmers, food banks, and distribution sites in the implementation of the Farmers to Families program that was implemented by USDA in 2020 to address food insecurity and disruptions in the supply chain experienced by farmers during the pandemic. I am happy to share findings from this study at a later time. If you are interested, I would talk a little bit more about the emergency food assistance and food security study in the next slide. But on the other 2 projects that I'm involved in, the Food Nest, which is a modeling the future of food in your neighborhood study, we adapt participatory system modeling approach to map out the complexities and dynamics of the local food system to identify levers of change. For BCOP, which is the Building Capacity of Obesity Prevention Project, mostly we provide web-based diagnostic tools to help SNAP-Ed and public health practitioners to successfully implement and sustain community nutrition policies, systems, and environmental interventions in rural and urban settings. To place this more in context, we are adding 2 new PSC areas, and one of them is food pantries. So that actually
Rosie that was probably calling you from here.
That tells the importance of food pantries, and it's been important, but I think now there's been more attention on food pantries and their role in helping households meet their food needs. Today's presentation, as I said, is part of a pilot award for my study on emergency food assistance and food security in Cleveland. In this research, I am partnering with the Greater Cleveland Food Bank to explore spatial and temporal patterns in the use of food pantries in selected neighborhoods in Cleveland. As part of our study approach, we will be adapting qualitative research methods to further explore food needs and the value of food pantry to clients, as well as community and individual level barriers that affect the utilization and efficiency of food pantries. We are also going to adapt an observational needs assessment tool that will score selected pantries to identify variations in needs among food pantry sites across Cleveland, and also see whether these variations in needs has any associations with the use of specific food pantries. Today's presentation, I'm only exploring changes and patterns in emergency food assistance, which I'll be referring to as EFAs, in 2019 and 2020 in Cleveland. So this is just a small portion of the entire study, and these are preliminary findings. I am open to suggestions and feedback on how to improve upon this work and make great impact with this research. So as far as the outline of our presentation today, we will begin with the discussion by reviewing trends and patterns of food insecurity in the country, as well as some data on Cuyahoga County. I will also discuss some of the ways in which COVID-19 impacted food security in 2020. We would then present the research questions for our discussion today, and then we would dive a little bit deeper on the Emergency Food Assistance Program, just some background on what it is and who is involved. Following that, I will review the data that was used for this work, the methods, and the results. We will then wrap up with key findings, implications, and some limitations of the study. I'm going to try to leave more time at the end of the presentation for questions and feedback, since I am looking forward to those feedback. So to begin off, last month, the USDA released the 2020 Food Security Report. In that report, they found that the proportion of food insecure households in the United States remained the same. If you look on our chart, you would notice that overall household is the green line. If you compare it from 2019 to 2020, it remained at 10.5, which is great for most reasons, because there were like earlier predictions by Feeding America and other like researchers that food insecurity was going to worsen in 2020. Even like, I think another great thing is that for white non-Hispanic Americans, food insecurity actually declined between 2019 and 2020. It went from 7.9% in 2019 to 7.1% in 2020. On the other hand, the situation for Black and Hispanic population was different. Food insecurity actually worsened for Hispanic population and Black and African Americans in the country. This widened the gap, the food insecurity gap between white and minority that already existed prior to the pandemic. For Hispanic households, it increased from 15.6% to 17.2%. For Black and African American households, food insecurity, it increased from 19.1 to 21.7. These changes represent about 13.6% increase for Black non-Hispanic households and 10.2% for Hispanic households. These racial disparities in food insecurity, it's also evident in Cuyahoga County, where Cleveland is located. In the county, it's been estimated that about 56% of African Americans live in food desert compared to 23.5% of white population. These significant racial disparities in food insecurity is associated with racial disparities in the drivers of food insecurity. Feeding America has identified these 5 factors as factors that drives food insecurity. This includes disability, home ownership, median income, poverty, and unemployment. You will note that if you compare poverty levels for Black and African American households to poverty levels for whites, you would know that it's more than doubled the rate for white population. If you compare unemployment rate among Black population is 10% compared to 4.4% in white population. These drivers point to the fact that addressing food insecurity involves more than just handing out food to food insecure households, because there are a lot of other things that are at play that makes it difficult for households to provide for their families. Another dynamics that made food insecurity situation a little trickier and challenging was the COVID pandemic. So the pandemic deepened these disparities that already existed prior to the pandemic. Apart from the disproportionately high COVID-19 cases and death among minority population, the economic crisis and food shortages it created significantly impacted low-income households. We know that sharp economic declines resulted in high unemployment rates, which meant that people who became unemployed could no longer afford for food for their households. Another thing that happened was there was a lot of hoarding of food. I'm sure most of us, rushed to the grocery store to purchase food and cleaning supplies at the beginning of the pandemic. That resulted in food shortages. Now, I would want you to think about it. Who would you think would be most impacted by food shortages? These are people who lived paycheck to paycheck prior to the pandemic, people who lost their jobs, because you need to have enough money to be able to stock up for months, or even just like a week in advance or a month in advance. So all these further deepen the disparities that already existed. Another critical thing that happened during the pandemic was school closures. That also disrupted access to school meals for kids. It's been noted that in some communities, school meals are the only meals that students get to eat in the day. So without those, that also created a challenge for households. The closure of schools disrupted access to school meals for most students. We know that there was effort to provide meals to students on bus routes, and also sometimes even at pickup locations where parents and students could pick up. But so far, some studies have shown that the program did not reach all students as it was anticipated to reach out to. And if you think about it, when you have to pick up at a location, you need transportation to go to those locations. If you don't have transportation, you couldn't pick up. If the time that they are available doesn't work for your parents are working during those times, you wouldn't be able to pick up those lunches. So while these efforts were all great, there were still some food insecure households that were created as a result of school closures. Another area where there were a lot of changes during the pandemic that impacted food insecurity was changes in the food environment. So this widened the disparities as well. So social distancing requirements and fear of contracting COVID-19 resulted in fewer trips to grocery stores. So most people resorted to drive-through pickups, online shopping, and deliveries. Some food pantries actually also closed, and others offered limited hours. All these resulted in increase in food insecurity and food insufficiency. It's important to note that the digital divide in urban cities in Ohio is very wide. So for even ordering food online, it is also a challenge for some of the populations that were food insecure. Well, now to sum it up with some data showing how much food insecurity we're seeing between April and 2020. The 2020 household pulse survey, which is administered by the Census Bureau, indicates that between April and May of 2020, about 43% of all Americans experience food insufficiency. This reflects to about 23% food insecurity. Now, the racial disparities in food, food insecurity between April and May were also far worse. For Black and African-American households, about 55.5% reported having insufficient food for their household. About 35.7% were food insecure. Now, if you look at households with children, that was even worse. For Black households with children, about 57.9% experience insufficient food in their household, whilst as far as food insecurity, 40.9% were food insecure. It's important to note that these numbers are significantly different from the USDA report because these only ask for a short period of time. USDA report considers food insecurity for the entire year. So this is where there is some differences in the number reported in the pulse survey compared to the USDA reports. Well, the pandemic also drew more attention to emergency food assistance program. If you just Google emergency food assistance program during the pandemic, you will see a lot of headlines related to EFA programs supporting households. You will see some information on long queues at food bank. You would also see some headlines about even the National Guard supporting some food banks to provide food. And this was true for us in Cleveland. The Greater Cleveland Food Bank did receive some help from the Ohio National Guard to package and distribute food during the pandemic. Now, why is it so important to look into emergency food assistance? Work from Dr. Friedman and her team, which I'm part of that lab, has found that emergency food assistance is very essential in meeting basic food needs in racialized communities. Aside from emergency food assistance, other things that have been identified as playing critical role in meeting food needs are side hustles, so the ability for households to have an additional stream of income. It's very essential in meeting food needs. Other things also like government benefits, so WIC, SNAP, as well as Medicaid, childcare, they all contribute to the ability for racialized neighborhoods to meet their food needs. So it's very essential for us to understand the patterns and how this influence food insecurity in general. Now, in view of all this background that I've given, the remaining of our time will be used to explore the impact of COVID-19 on EFA use in Cleveland. We will discuss the spatial patterns of EFAUs and also discuss some implications of the results and findings as we move on in our discussion. So, excuse me. Yeah, before we go into that, I would want to give a brief background about the Emergency Food Assistance Program, the structure. So the USDA is responsible for allocating aid to states and coordinating the ordering, processing, and distribution of commodities. States and recipient agencies then place orders for certain quantities and types of commodities. When you come to the state level, the program is administered by an agency designated by the governor or appropriate state's executive authority. The states, however, delegates these responsibilities to food banks, who receives all food, and then they make deliveries to other recipient organizations such as food pantries, soup kitchens, and also shelters. In Ohio, there are a total of 7 food banks that serve the state. The Greater Cleveland Food Bank is one of them, and they serve parts of Northeast Ohio, including Cleveland. Each region indicated by the same color shade on the map is served by one food bank. Now, just a little bit about the Greater Cleveland Food Bank. So it is the largest hunger relief organization in Northeast Ohio. They partner with over 1,000 distribution sites in Northeast Ohio. In 2020 alone, they served over 400,000 clients in their service area. The work that I'm sharing today is a product of a partnership between researchers and the Greater Cleveland Food Bank. The next sessions will discuss the data, the methods, and the results. So as said, this data that we use was shared with the team by the Greater Cleveland Food Bank. It is a data that is collected in a cloud database system called Pantry. The data is entered by food pantry staff or volunteers. So for any time a client utilizes food pantry, they have an ID number and they record any visits, the address of the client at the time of the visits, the size of the household, so how many children are in the household, how many adults are in the household, and how many seniors are in the household are also recorded. And then they also record the type of services that they receive. I know most of us are familiar with the fact that food pantries and all these partners provide food, but then they do provide other services. They provide like hygiene products for their clients as well. So all that is it's shown in the data. For this analysis, however, we are focusing on clients who identified the city of Cleveland as their city of residence at the time of service. In conducting this study, the first step was to clean the data that we received. So the original data set included the entire Cuyahoga County. It also included non-food related services. So as I mentioned, they do provide non-food related services. We did exclude all non-food related services, and we also excluded clients who reported residence outside the city of Cleveland from our data. For our spatial analysis, we only included addresses that could be geocoded to specific parcels within the city of Cleveland. We excluded clients with no addresses or clients that reported homeless because we could not geocode their location. Also, addresses that were geocoded to street segments or zip codes were excluded from our data since our analysis is at the census tract level. So when we say it's geocoded to a zip code, it means that for a specific address, so let's say you provide your address, but then there's an error in the address, but your zip code is accurate, we are able to geocode the location to a specific zip code. But then as we know, zip codes transcends beyond census tract boundaries. So if say you said you lived in 44012 zip code, you could be in any census tract within that zip code. So in order to reduce error, we decided to exclude those addresses that could not map to specific census tracts. Finally, data analysis were conducted using Stata, Excel, and ArcMap 10.7. All the map data are standardized On the next slide, I will talk a little bit more about the cluster and outlier analysis that we use for this study. So we use the cluster and outlier analysis, which usually geographers call LISA. It's the local indicators of spatial autocorrelation. Mostly this is used to identify concentrations of high values, concentrations of low values, and spatial outliers. So where there are concentrations of higher values, usually I'm sure most of you have heard hotspots. It means that there is concentration of high values. If there are concentrations of low values, it's usually referred to as cold spots. And then where there is a mix of higher and low values, then that's where it becomes an outlier. If you are like a high value surrounded by low values, then you are an outlier. If you're a low value surrounded by high values, then you are an outlier. I showed the equation for generating this indicator. I'm not going to go into that, but basically what this indicator does is it takes the value for a specific location. So let's say we are working on a specific census tract. It takes that value if it's like poverty, and then it compares the poverty of that location to the mean of poverty of the surrounding locations. And then it tells whether the value for that location is higher than the mean, or it's lower than the mean, or is similar to the mean. Based on that spatial relations, it clusters all the locations into either a hotspot, a cold spot, or an outlier. We use these cluster maps to show the location of significant spatial clusters and outliers in emergency food assistance use between 2019 and 2020. Now to the data. On the left side of your slide, I show the trends in emergency food assistance visits in Cleveland in 2019 and 2020. These include duplicated clients if you visited the pantry more than once a year. The blue line represents data for 2019, and the gray line represents data for 2020. We note that overall, there were significantly higher visits in 2020 compared to 2019. There was also significantly higher clients in 2020 compared to 2019. In 2020, about 7 in 10 Clevelanders received EFA compared to 5 in 10 in 2019. So you see there is some increase in the amount of people who received EFAs. I just want to point out a few differences in a few points of either like significant increase or decline in the chart. So in February, if you look at the charts, you would see that EFA visits in 2019, which is indicated in blue, was higher than EFA visits in 2020. This was prior to the pandemic. At this point, there is no way to tell if this pattern would have continued without the pandemic. I think maybe we can do some extrapolations and compare to previous years and see if February was just a different time for all the food banks or for all the food pantries, or this is just like a different scenario. But when you look on our graph, you see that we see significant peaks in April of 2020 and in August of 2020. We also see the significant declines in May of 2020 and some amount of decline also in September of 2020. The increase in food needs in April is associated with the pandemic and its associated economic crisis. In April, the pandemic relief programs that were implemented, such as the stimulus checks, pandemic EBT, and unemployment assistance, may have placed some households in positions where they could provide for their families. And that's probably why we see a decline in May. Again, there still needs to be more research to ascertain the impact of these relief programs on food security in 2020. Also, the spike in August, I have been like looking into like why was there a spike in August? And one of the things that in my discussions with the Greater Cleveland Food Bank and other people was that at the end of July, the federal pandemic unemployment compensation expired. It expired on July 26th. And with this federal pandemic unemployment compensations, people who were receiving unemployment benefits were getting an additional $300 a week from the federal government. So if you think about it, cutting off $300 a week is a lot. So that could have accounted for the spikes that we saw in August of 2020. Apart from that, you also see that, following these periods, their visits, consistently stayed higher compared to, earlier periods of the pandemic. Also in September, the pandemic emergency unemployment compensation, which extended the traditional unemployment benefits, also expired. It expired on September 4th. So at this point, if you have exhausted your unemployment benefit that you're entitled to, then you were no longer receiving any unemployment benefits. That could account for the consistent, higher amount of visits as well as clients towards the end of 2020. Although we know very little about the impact of the stimulus checks on food insecurity, data from the Household Pulse survey shows that about 59% of Ohioans spent their first stimulus checks on food. So, we still need to do a lot of analysis, but this tells some, story about why there probably weren't that much need and reliance on EFAs in May of 2020, because people had money to buy food for their households. You should note that these totals may not sum up to 100% because in the survey, you could select multiple options. So you could select food, you could select utilities and all that. So I just wanted to draw attention to how some of the population in Ohio spent their stimulus checks. Now, of the almost 100,000 households that received EFAs in 2020, about 37% of them had not received EFAs prior to 2020. This translates to about over 36,000 households. So these people were new to using food pantries at the time of the pandemic. Now, as far as the spread of new clients that were received, we note that in April, a significant proportion of the clients that were served through EFAs were new. So about 22.8% of the population that received emergency food assistance in April of 2020 had not received emergency food assistance prior to that. We will talk more about some of the ramifications of first-time emergency food assistance use and their impact on mental health and other aspects of their life that we would have to think and consider even as we head into these times where we feel like things are a bit okay, but I'm sure we still need a lot of effort to address food insecurity. If you compare to 2019, you would note that in 2019, across the entire year, for each month, the proportions of new clients range from about 5.4% to, I think the highest was 8.1%. So obviously in 2020, there were more new food pantry users in Cleveland. Now I'm gonna move on to some of the spatial maps that we did. So these two maps that I show here are comparing EFA use rates in 2019 and 2020. As you can see, the east side saw significant increases in EFAs in 2019, in 2020. In 2019, over 50% of the population in parts of Sloviak, Stockyard, Broadway, they all showed some increase in EFAs used in, they all had over 50% of their population receiving EFAs. In 2020, however, areas in Goodrich, Kirkland, Glenville, West Boulevard, Union, Mouse, and Leesville saw significant increases in EFA use. So this is the rate per 100 on your from the legend. It's per 100 of the tracked population. So over 50 means there are more than 50% of the population in these tracts receive emergency food assistance. Now, we also note that areas with significant increases in EFA use in 2020 are predominantly Black and African American communities. On the map to your right, the darker shade of purple indicates areas with over 50% African American population. If you compare that to emergency food assistance use in 2020, you could see that they both correspond to areas where there are significantly higher African American population. Available data have shown that disproportionately impact of the disproportionate COVID-19 cases and death among minority population. We do observe similar patterns in food, emergency food assistance use during the pandemic. On this map, I show EFA users the change in EFA use between 2019 and 2020. So this is the percent change. Only few tracts saw a decline, a negative change, which meant that they saw a decline in EFA users. It's important to note that this might not necessarily reflect that there was less need, but we note in other studies, in other data collection that we have done so far, that there were a lot of food distribution going on during the pandemic that are not captured in our data. So we cannot clearly say that where there was a decline in EFA use, it meant that they did not have a need, or it meant that they didn't have some impacts of COVID-19. This map also shows hotspots of average EFA visits in 2019 compared to 2020. We note that the patterns that are observed are very similar. So the hotspots are over on the east side in 2019 and also in 2020. We see an outlier towards the west side that it's identified mostly in West Boulevard neighborhood. Similar patterns, as you can see, there was an increase in need, but once you do the spatial analysis, it tells you whether the concentrations are different or the same. The map that I showed earlier showed significant changes in EFA use in 2019 and 2020. These maps shows where there were clusters of emergency food assistance users. So whether there were concentrations of higher proportion of use, or there were concentration of low proportions of use. We found significant cluster of high EFA use on both the east and west side of Cleveland. In 2020, however, there is a decrease in the hotspots on the east side. Overall, the patterns seem similar. If you see the patterns, they seem very similar. The only difference that you note is that some census tracts that were hotspots in 2019 and were no longer hotspots in 2020. Like I said, this may not be as a result that there was no need, but probably because our data that will capture the other food distributions that are not through partners of the Greater Cleveland Food Bank. The last spatial cluster map shows where new EFA users were clustered. So prior to the pandemic, new EFA users were on the west side and also a little on the east side. But as you can see, in 2020, these EFA use concentrations of new users in west side were no longer significant. It was mostly towards the east. So when it comes to where new users emanated from, it was mostly towards the east side. And this is mostly the downtown area neighborhood and the Old Brooklyn neighborhood. So those are the areas that shows higher clusters of new emergency food assistance users. Now, the next few slides will focus on the EFA sites. So overall, about 70% of the sites visited by EFA users in Cleveland were located either within the city of Cleveland or within a mile of the city boundary. When you compare these 2 years, 2019 and 2020, we know that one of the significant differences that you see is how much visits were received at mobile pantries. In 2019, only about 3.4% of all visits occurred at mobile pantries. In 2020, however, that increased to about 10.5%. It's important to note that a lot of the mobile pantry visits were at the mini lots where the Greater Cleveland Food Bank operated and provided drive-thrus to supply food for households. This map shows the top 10 EFA sites in Cleveland comparing 2019 to 2020. In 2019, the largest recipient was the Cleveland Kosher Food Pantry, which is in South Euclid. It is not even in Cleveland. that had the largest amount of visits. In 2020, however, the mini lots had the largest visits in the entire Cleveland. We do plan to delve more deeper into origin destination analysis for food pantry visits in the larger study as discussed. So hopefully we will be able to identify where do people originate from and where do they access food pantries. I think it's very important to look at this dynamics, because a lot of studies have shown that there is stigma attached to using food pantries. We would definitely like to know, do people deliberately move outside of their neighborhood to visit pantries that are outside of their neighborhoods just so people do not see that they are accessing emergency food assistance? Or like, what are the dynamics at play when it comes to where do people receive emergency food assistance? And finally, I would want to go over a few key findings and implications. As discussed, these are preliminary findings, and we are looking for feedback and questions even as we move through this. So we find that food need in Cleveland grew significantly during the COVID pandemic, indicating the severity of food insecurity during the pandemic. Also, economic relief programs such as the stimulus checks, pandemic EBT, unemployment benefits, and schools meal to go may have accounted for the fluctuations in emergency food assistance use in 2020. As said, we still need to do a lot more research to ascertain by how much these economic relief programs impacted food insecurity. Also, findings from the cluster analysis showed that spatial patterns of food assistance use observed in 2020 were very similar to that of 2019. This signifies the endemic nature of food insecurity in the community prior to the pandemic. So the spatial patterns that we identified, points to the fact that yes, the need for emergency food assistance increased, but the areas that have always been concentrations of high food, emergency food assistance need remain the same during 2020. So the problem is not just with COVID pandemic. There are some systematic and some issues related to households' ability to access food that needs to be addressed. And so we do suggest that effective food security efforts in racialized neighborhoods must address the root cause of food insecurity. And it should also offer more dignified solutions. Some of the work at our lab has shown that people see more dignity in the ability to provide food for their households rather than being handed some food from the food pantry. Also, the significant influx of new users, particularly in April 2020, could be attributed to the economic crisis experienced at the onset of the pandemic. It could also be as a result of food shortage, or also probably because of uncertainties about the future at the time. I know for most of us, even for me at the time, I was like, how long are we going to be on lockdown? Like, what do I need to do? So that could also be people just rushing to get food to keep in their household if they couldn't afford to buy. It's important to note that new users are more likely households whose food security status changed due to the pandemic. Also, first-time food assistance visits can introduce emotions of anxiety, apprehension, and embarrassment due to the stigma attached to utilizing food pantries. I think in view of that, I think it's important for us to consider like how did this whole pandemic impact, mental health, because it's very challenging for somebody who was able to provide for their household to find themselves in a situation where they need to visit a food pantry in order to be able to provide for their households. There has been studies that show that there's a bi-directional relationship between mental health and a person's capability to provide basic food needs for their household. So in thinking about food, and the impact of COVID on food insecurity, I think we need to think beyond just the food, but how did that impact, mental health and other aspects of the life of households in the city. On that note, I'll just share a few limitations to the data that we use. So the data presented only account for EFA use at partners of the Greater Cleveland Food Bank. There are other emergency food assistance sites that are not partners of the Greater Cleveland Food Bank. So this data, it's probably underrepresenting emergency food assistance use in the city. Also, clients who reported that they were homeless or could not provide addresses at the time of services were excluded from the spatial analysis. I think it's very important for us to dive deeper into the homeless population who access food during the pandemic, to look at some of the implications and how that can inform policies. In our analysis, we do exclude these populations from our research, which I think it's a huge limitation to our study. Also, cluster analysis could produce different results if the boundary of the study is extended beyond the city of Cleveland. So like, as I said, in doing the clusters, it compares the value for a specific location to the neighboring value. So if you cut off a boundary and eliminate some neighbors, then you are, inadvertently like influencing the cluster analysis for that area. So mostly for tracts that are located along the city boundaries that share boundaries with other tracts, if we had included the whole county, may have different results if we include the whole county. In our larger study, we would definitely want to do an analysis using the entire county to see if there are any differences in the results. Also, we do note that we really need more analysis to ascertain the causes of the changes in EFA use. I think we all assume that it was more of unemployment created by the pandemic. It was more of economic crisis created by the pandemic, but this could be a problem that already existed prior to the pandemic, as shown by the patterns of the spatial analysis that I showed. Also, cluster and outlier analysis identified and not clearly explained in these discussions. I think we are going to do more work in trying to interpret why did these clusters, show up in these locations. And like I said, we are doing more work. In the larger study, we are going to interview households that received emergency food assistance. We are going to interview households that only received emergency food assistance once in the entire year. We would like to know. I know for the most part, we would want people to only use emergency food assistance when there is an emergency. I always tell people, like, you don't go to emergency when you have a headache. You go and see a doctor. You only go to the emergency when you really need, you have an emergency. I think we would want emergency food assistance to be that kind of support. So obviously we don't want people to use emergency food assistance consistently throughout the year. But then we also want to know, one-time users just, do they all just needed it just once in the year, or they are not returning because of some experience that they had at the food bank? So we at the food pantry. So we are going to look at that. We are also going to interview pantry managers to explore some of the barriers in these sites as well. So there is more work to be done that hopefully I'll have the opportunity to share in other seminars that I can definitely let once we are ready to share the findings. And finally, I would like to acknowledge Dr. Friedman, who is the co-PI on the emergency food assistance and food security study. She's also the director of Swetland Center, and she is my mentor and my advisor as a postdoc. I also want to acknowledge Kristen Mickelbank and Fo Trimble, both of them from the Greater Cleveland Food Bank. They've been of great support. I know Kristen is on the call right now, and she's been supportive with data and been analyzing these data and trying to interpret some of these findings. I also want to acknowledge trainees and staff at Swetland Center. They've been of immense support for my work and helping me prepare for this seminar. This research is supported by the National Institute of Minority Health and Health Disparities of the NIH through the Center for Reducing Health Disparities at Metro Health case. The content as presented are solely the responsibility of the authors and do not necessarily represent the official views of NIH. I would like to thank them for the funding as well, and thank you for listening. I will leave you with this quote that I believe resonates with EFA use and addressing food insecurity. It says that there comes a point where we need to stop pulling people out of the river. We need to go upstream and find out why they are falling in it. I think it's important EFAs are great resources, but it's important for us to think much beyond that and in deeper, like ask deeper questions. Why are people needing EFAs? Why are people consistently using EFAs? What can be done to move people from food insecure households to a food secure condition where they no longer need EFAs consistently throughout the year? And on this note, I'll thank you and open it up for questions. Do you want me to stop sharing the screen?
You might want to leave it up. I think there are a few questions that go back. And before we jump into questions, I just want to thank you for such a wonderful presentation. So many great comments and questions coming up, and I'm happy to navigate those for you. And I also personally just want to thank you for sharing this last quote. It's an image that was shared with me a number of years ago, and it's one that's stuck with me in the work that I do. So I appreciate you bringing it up in the context of this issue as well. Let me pull up some, and folks, if you'd like to turn your cameras back on, we'll be sure to end with a round of applause for Dr. Yamoah, but I want to jump into some questions, and I'm just going to pull a couple from the chat now. Dr. Yamoah, there is there's first a comment from Dr. Friedman. 7 in 10 Clevelanders use emergency food assistance. Hope we're asking our mayoral candidates about how they are addressing endemic food insecurity. Very good and important point. From Brooke Kale, the fluctuations as they relate to relief activities are very interesting and shows how fragile the system really is. There's a, I think, sort of question from Adrian Mundorf, and Adrian, I may ask you to expand a little bit more, but on the, I think this is on the slide where you were looking at the high bands, the census tracts. She asks, curious if the high band over 50 to 100 tract saw an increase within the band in 2020.
Oh, sorry. Trying to navigate to that slide. Yes.
So if the band over 50 saw an increase within the band in 2020.
Yes, they actually did. So in 2019, this range was 50 to about 61%, but in 2020, the range was 50 to 81%. So although it's the same like range over 50, some went to as high as 80% of their population using emergency food assistance program. I think maybe in future I'll probably have to like elaborate so you can see how like even within the same range there were changes.
John Corlett comments that some providers may have also closed or limited their hours during the pandemic. And that, how might that change some of your results? I think that I'm interpreting the comment to sort of reflect on your work.
Yeah, I think that's a great comment. I think, as I shared, one of the changes in the visit to sites that occurred was the mini lots that the Greater Cleveland operated during the pandemic. So although some pantries were closed and limited hours, I feel like they were sort of accounted for the visit that they received at the mini lots. So obviously, maybe there could be some differences, probably a higher increase or some change, but I feel like in terms of the pantries, based on the data that the Greater Cleveland shared, they still saw significant increases in 2020, even with the limited hours and pantries closing.
And I think a little bit related to that, Dr. Friedman asked, does change in hotspot get at the transportation requirements to get EFA?
That's a great question, Dr. Friedman. I think at this point, we really haven't done any like origin destination analysis yet. I think once we delve more deeper into where did people originated from and where did they receive EFAs, we may be able to tell like how close they live to these sites or how far they move to access these facilities. I think that's where we'll be able to tell whether transportation was a major factor in determining some of these clusters that we see.
And I'm happy to keep reading from the chats, but if there's anyone who would like to ask a question, please raise your hand and I will stop talking. I'll go ahead and move on to the next one though, in case anyone's thinking about hitting the raise your hand button. Do you have a map showing the distribution of food pantries in Cleveland? This is a two-part question. So I'll ask that one first. Or if you could comment on the distribution of food pantries within the city.
Yeah, I don't show that map, but that was a map that I think when I saw the clusters, I wanted to see whether the clusters had anything to do with where they are located. And as you could even tell, even the mini lot where the mini lot was located didn't show up as a cluster, like a hotspot. So I think it's probably reflecting that people travel from different areas to access food pantries in different locations. So it may not necessarily have much to do with where the pantries are located. But like I said, we probably would do more with when we look at the origin destination, we'll be able to tell where are people moving from to access food pantries. It looks like the clusters aren't necessarily because of concentrations of food pantries in those areas.
And then the second part of that question is, to what extent do you think Black churches in Cleveland are moderating the effects of racial disparities in food insecurity?
That's a very great question. Can the person elaborate a little bit more?
Sure. Let's see if that person's still here and able to ask. Let's see.
Yeah, I'm still here.
Here you are.
Yeah, like I just wanted to know, like I know a lot of food pantries are churches, and I'm only curious to see the role of the church to African Americans, because if they have access to pantries that are located within the church, I think that would be much better than going to a general food bank or food pantries, because I think the problem here is about the access to the food pantries. If they do have access to food pantries to the churches, I think that would probably reduce the disparities in racial insecurity.
Thank you so much, Abolade. So that's a great question. I think first off, I think a lot of the research at Dr. Friedman's lab and so many other researchers are finding out now that the problem with food insecurity is not just about access. It's not just because you cannot travel to it or you don't have as a physical access, but also like having the money to afford it, and also some dignity in the food that you receive, your ability to choose what you want. So that in that aspect, I think I can add on to that as far as the access, being able for them to have like income to afford it, and also having some food choices that are culturally appropriate for these communities, or things that people will be able to eat that will be helpful. As far as like pantries and churches, I think some of them are partners with the Greater Cleveland Food Bank, some of them are not, as I shared. And so this data that I presented might not capture some of the EFA used in some of the churches that provide food pantries. But obviously, I think it'll be great to look more into that and see how churches are contributing to EFA use in Cleveland.
Thank you for those questions. Dr. Kim shares very important points in the implications. I also wonder about how the, quote, new use of EFA introduces more longer-term worries about food insecurity by disrupting people's overall sense of security and the impact of that on mental health going forward.
Yeah, that's a really great point. I think as expressed in that towards the end, I think it's very important to think about the mental health of these new users. And we are hoping that, in the data collection, we'll be able to recruit some of these new users. So the food bank is willing to send out recruitment text to users, and then hopefully we will get like people who will respond, and hopefully there will be some of the new users. And we are looking forward to ask them about like the condition of food insecurity in their household at the time of use, and why they didn't go back, or whether they don't need it anymore. I think we definitely want people to be weaned off emergency food assistance. We don't want them to use it all the time, but then we also want to know whether they are okay. That's why they're not using it. So I think we would learn more about that through our interviews. Hopefully we are able to recruit some of the new users in 2020.
Wonderful. There's a question from Kakul Joshi. I'm wondering if TFAP income eligibility was expanded for clients in Ohio. And if yes, any thoughts on how that would have affected the use of TFAP among clients during the time frame of your study?
Yeah, thank you, Kaku. Yes, definitely. So during the pandemic, it was expanded. I think I don't have the numbers off the top of my head, but they did expand the eligibility. So people who were not eligible prior to the pandemic were eligible during the pandemic. I think another thing that I forgot to bring up is at some points in the pandemic, the states relaxed regulations as far as like taking, information on recipients of food, emergency food assistance. So that could also like mean that our data could underrepresent the actual use, because there was a time when they were just handing out food without taking, details about these recipients. So definitely the income eligibility change definitely could have made some difference. Unfortunately, we don't have data on the income of recipients, so we cannot really tell much about like their income at the time of the study, but we could probably get more information during the interviews about like their income at the time of EFAUs. Yeah, thank you so much, Kaku. That's a great question.
And Kristen, thank you for adding your comment that TFAP was expanded from 200 to 230% of poverty. That concludes the questions in the chat. Is there anyone on the seminar right now who'd like to ask a question? And Dr. Yamoah, there are complimentary comments from folks who have very much enjoyed this presentation, so you can enjoy those as well.
Yeah, thank you so much. It was a pleasure to be here to share my work.
Yeah. So any other questions for Dr. Yamoah today? Right. If not, Dr. Yamoah, I might ask you to turn off your screen share, and I might ask if everyone turn on their camera, and let's give Dr. Yamoah a round of applause.
Thank you.
Thank you so much for joining us today. I'm sure for those of you who have been with us before, you know that we share the recording of these presentations on our website. If those of you who are attending for your first time, we will post this within the week on our website at www.prchn.org to go back so that you can go back and catch all of these important bits. Again, thank you, Dr. Yamoah, for your presentation, and we hope that you all will join us next month on November 10th for a slightly different conversation on research around COVID-19. Thank you so much and have a wonderful day.